The group of girlfriends who are the smartest in the house. You have been here all day long and have learned so much from our wonderful presenters. And this is my good friend, Dr. Amber Stevens. I want to read to you a little bit about Dr. Amber Stevens. She is a family medicine physician trained at Drexel University College of Medicine and residency at Bayfront Medical Center. She's currently working at Optum Medical Group in Dunedin and has been practicing medicine since 2005. This girlfriend has a lot of experience, a lot of wealth of knowledge to share with us today. She is a certified coach with Faster Way to Fat Loss. She continues to practice full-time medicine, but Dr. Stevens has found passion in fitness, and I have seen her Instagram pictures of her exercising with her kids or a dog, particularly in strength training to improve overall health and well-being, improved health problems, and focusing on the root causes of chronic disease. I love that that's been a theme today. She has lived in Pinellas County since 2005 and is married to her husband, Ben, of 15 years. They have two amazing, fun, busy boys, Tucker and Raylan, 9 and 4. I love this part. She also has a zoo of sorts with 2 dogs, 2 cats, a bearded dragon, I've seen that picture too, a turtle, and 3 snakes. So please welcome our girlfriend, Dr. Amber Stevens.
So I'm going to take this off because I like to walk around. So my name is Amber Stevens, and I am a family physician in Dunedin. I have been in Pinellas County since 2005. I've worked in St. Pete, Largo. I did urgent care for a little bit in multiple locations, and then now I've been in Dunedin for, 3.5 years. Go back. Sorry. So, like she said, we're going to be talking about strength training. But first of all, I wanted to introduce my lovely little family. This was us at Christmas time in front of the tree. My husband plays guitar here on Sunday mornings, and then these are my crazy monsters. So, all right, you can go ahead and switch. So, who am I? We got a little bit of the intro already. I am a family physician. I am board certified in family medicine, so that is an extra. You don't just have a doctorate, you actually have board certification. I do currently work for Optum Medical Group. We do focus on geriatrics, but we do see people of all ages. I have some information over at my booth. If you are looking for a doctor, I'm not here to take you away from someone you love, though. So there's plenty of patients and plenty of doctors in Pinellas County to go around. So I am a certified coach for the Faster Way to Fat Loss. And that's something I actually started with about 2.5 years ago and joined as a coach in the last year. It is, it's very different than anything else that I have tried before, and I'm happy to talk to you about it, but that is not why we are here today. I am a wife and a mama, as you saw, and then we'll go to the next slide. So I like this picture because I think when people think about strength training, this is where their mind goes. And they go, I can't do that, okay? Well, I can't do that either. And I don't think I'm ever gonna be able to do that because I'm not a roided out man, okay? But the definition of strength training is a period of training in which high levels of volume, weight resistance with minimal rest periods resulting in muscular hypertrophy. And I just stole that off the internet, full disclosure. Go ahead, next slide. So what does this actually mean? So when we do strength training, what are we actually doing? We are actually causing damage. This is a good thing, okay? And the reason why is, let's look at these car pictures. So the first picture on the left, well, yeah, your left, my right, is the car before exercise. Nothing wrong with it, just not super fancy, get you from point A to point B. Then we get in a little bit of a fender bender. We have muscle fibers are a little damaged from the exercise. We tear the muscle fibers. Then, after some rest and recovery, we get to become the sports car, okay? Your muscles build back stronger and better than they did before. The body is so cool, you guys. Literally, Iron sharpens iron, okay? We literally get stronger by damaging our muscles a little bit at a time. So, go ahead, next slide. So, how does it actually help our health, though? So, stronger muscles do equal stronger bones. We get reduced pain from arthritis. We reduce obesity, we reduce diabetes, and we improve mental health. So, go ahead, next slide. So, things get a little busier here. Bone health. So, we all hear about you got to do this weight-bearing activity to get stronger bones. I know that's what I tell my patients when I get their DEXA scans back. Do weight-bearing activity. But doesn't just mean stronger bones. It actually prevents falls. Your balance is better. You have less trouble getting up from a chair. And guess what? If you fall, you can get off the floor. So, and you laugh, but it's a real problem. So I tell my patients all the time, if you don't do strength training, what's your goal? I don't have a chair, but if you're sitting in a chair, you need to be able to stand up without holding on, okay? If you can do that, you're halfway to being able to get off the floor. Stronger muscles do prevent injuries during falls because they create extra space between your bones and the outside. So when you land, you got a little cushion. And it does prevent and treat osteoporosis, or that bone thinning, and it prevents the fractures by getting stronger. So, like I said, number one thing we tell people, weight-bearing activity. But we always tell people, that can mean walking. There's nothing wrong with walking. Walking's great for your heart. It's great for general muscle health. It's good for your mental state. Let's face it, we live in Florida. Let's take advantage of the weather. But adding some strength training in gives you more resistance, which means if you get 2 steps with walking, you're gonna get 5 steps with that strength training. So building stronger muscles means more strength to your bones as well. The force of the weight from the strength training actually puts that strain on your bones. So we talked about the muscles being damaged. It doesn't damage the bones, but it pushes on them. Your body responds by creating thicker bones. So just encourages them to go stronger. Next slide. So arthritis and joint pain. So first thing I want to say, it's not going to cure your arthritis, okay? If the bones look like garbage on the x-ray, they're not going to look less like garbage. But if you make the muscles around the joints stronger, there's less pressure on the muscles, there's less pressure on the bones themselves. So we now are taking that, when you're walking, instead of the bones clinking together, it's your muscles absorbing that activity. Takes pressure off your joints. The other thing is we lose a little bit of fat. We literally have less pressure on our joints because we weigh less. All right. Oh, I'm sorry, one more thing, go back. I put a posture picture up here because muscle strength gives us better posture. You can see the skeleton on your left. The posture, you see the dotted line going up and down, that's that straight posture. When we're less strong and we have a little extra weight, the pelvis tilts forward, we end up with a little bit more of the hump, and then our belly's pulling down. Now our back hurts, we end up getting tight hip flexors, which is gonna make your balance worse, and then that affects your whole, how you walk. And your body's meant to be very even and wants to be as symmetrical as possible. And if we're doing this, that's really hard on your joints also. Get stronger, better posture, we walk straighter. Okay, sorry, now we can go. So next topic is obesity. So I know you guys have been hearing about obesity and stress and everything else today. I don't want to bore you. I did put a fun little sciencey picture over there because science is cool. All right, I'm a doctor, science is cool. But basically what this picture shows to the side, and I didn't make it very big because I don't want to bore you with biology, but essentially, your fat responds to hormones from your muscles, from your fat cells, from your liver, into your bloodstream. It's all connected. But strength training and increasing our muscle mass increases our caloric needs throughout the day. So literally, our basal metabolic rate increases. Guess what that means? You get to eat more food. All right? We like that. This, in turn, increases your body fat usage. Okay? So your body's dipping into stores, and it helps use your glycogen. Now, glycogen is in your liver. It's a fatty sugar, and it's your body's backup plan. So, you ate your breakfast, 10 o'clock rolls around, you're jonesing for that mid-morning snack, and you don't get it. Liver dumps the glycogen, blood sugars come back up, you make it through the morning. But too much glycogen, now we're talking fatty liver, okay? Muscle mass reduces the storage of glucose as glycogen or fat by actually using it. And the fatty liver, if you get fatty liver, it's associated with diabetes, heart disease, gallbladder disease. It can cause immunocompromise. So not a direction you want to go. In fact, before people even can have bariatric surgery, they have to go on a severely low carbohydrate diet to force their body to use all this extra fat so that their liver will shrink to make the surgery safer. Loss of fat reduces the strain on so many body systems, particularly the heart and the circulatory system, because it doesn't take as much effort to push that blood through the body. And your blood pressure will literally drop just by losing some fat. So, go ahead and switch. So, we'll talk about type 2 diabetes. We see more diabetes in this country than most other countries. I don't think anybody's surprised when we know that there's an obesity epidemic here in this country, and that in turn means we have a diabetic epidemic. This increases heart disease, inflammation, and we end up with much higher cost of health care because of it. But strength training can be part of our answer. So muscles do not need insulin to absorb sugar, okay? We talk a lot about insulin as a sugar-reducing hormone, and insulin itself is actually a storage hormone. Your body uses insulin to take the sugar in your bloodstream and shove it into the cells. So that's how it ends up in the fat cells, that's how it ends up in your brain cells, your skin cells, all the above. And your muscles don't need it. They have special channels that open up and say, hey, I'm working out, give me all the sugar. So you literally can lower your blood sugar just by exercising. Now, yes, go for a walk, that will lower your blood sugar. Get on the treadmill, that'll lower your blood sugar. Go for a bicycle ride, that'll lower your blood sugar. Stress your muscles out really hard, that lowers your blood sugar even more. We do need some insulin, though. You need some insulin to build muscle. You need insulin to prevent yourself from losing too much weight. Your type 1 diabetics is a different process. That's an autoimmune disorder. Those people don't make insulin, and they literally lose weight because their bodies can't hold on to anything because they don't have insulin. So there's a balance to be had. But when you have too much insulin, it's a problem. So your blood sugar goes up from inactivity and dietary intake, causes your insulin to climb. If it goes up for too long, then your body starts to say, I've seen too much. There's too much insulin floating around. I can't handle this much insulin. I don't need this much. So then our receptors for insulin drop. Well, now we have more insulin than we need. It's not doing anything, and the sugar's not getting absorbed. Sugars are going up. Now we've got prediabetes, progression to diabetes. Too much is not good. We need to get the blood sugar down so the insulin doesn't climb. Muscle fibers, or the muscle cells, have these special channels that are activated during exercise to allow for quick fueling. And then we literally, as I said, can lower our blood sugars by exercise, and the strength training is much more effective than even just regular cardio. Go ahead and flip. So, like I said, cardio can help during the initial activity. So while you're doing that bicycle ride, while you're doing that walk, you're getting that benefit. When you stop that cardio, benefit's gone. Now, you do the strength training, because your muscles are continuing to work, that benefit continues to go on. And as our muscles get stronger, consumption of glucose goes even higher. That goes up long term, which means that our sugars in our bloodstream continue to go down, normalizing things, improving everything, and our diabetic situation starts to improve dramatically. Go ahead and switch. General mental health. Exercise in general drives endorphins. We all hear about runner's high. It's not just for the runners. Cyclists can get it. Weight trainers can get it. I usually hit about 10 minutes into my workout with the strength training, and the first 5 minutes, I'm like, why am I doing this? And then about 10 minutes in, I'm going, okay, there's the high. Let's go. Endorphins reduce your perception of pain. That's your body's morphine. You want to help your arthritis pain? Get moving, okay? Improves your mobility, which improves your activities of daily living, which I don't know about you, but being able to do things I like to do kind of improves my mental health. And overall improved quality of life and outlook. Next. So what does this really look like? So you can be this lady in the top lifting the barbell, doing a deadlift. It can be with the machines. It can be just normal body weight. The lady's doing a bird dog there. You can do compound exercises, use bands. They don't have to be heavy weights. We can do light weights. I had somebody ask me earlier, they said, I'm 87 years old. Can I do weight training? Yeah. All right, next. Women don't get bulky. That is a lie, okay? You will never get bulky unless you're roided out. It just won't happen, sorry. But we can do cardio, we can do strength training one of two ways. You can do it slow with longer recovery times, independent groups. So these are the people who do one group at a time. They're at the gym for like 2 hours. They take these long recoveries in between. They lift really heavy when they're lifting. Slow. You can do multiple body parts and compound moves, which speeds up the process because you're just not spending as much time. You don't have to do as many exercises to hit all the body parts. If you do shorter breaks, now your heart rate's going up. You got your cardio. My personal favorite is 30 minutes in and out, compound moves, don't take breaks. Get moving. Don't be intimidated. You don't need to lift heavy to get benefit, okay? Anybody can lift weights. You don't have to be grinding away at heavy levels. And you don't need any fancy equipment. Next. So I've got some pictures here, which are kind of fun. One, over here, this lady's using a little end table and a mat. We've got, this is one of my favorites. I have a child who likes to do that. All right. It's like, sure, Mom, let's do deadlifts with you on my back. Okay. So, do-it-yourself dumbbells in the middle. You've got peanut butter, cans, bottled water, weight container equivalents, vegetable cans, roughly 1 pound. Tub of laundry detergent, 6 pounds. Gallon of milk, 8 pounds. You want some paint cans? 9 to 11 pounds. Doesn't take a lot. Next. And the bottom line is anybody can do it. You've got people of young age, old age. My 9-year-old. My 9-year-old likes to work out with me. He's got my little pink 2-pounders while I'm lifting heavier. It's kind of fun. So that is what I've got for you. I think that's the last slide, right? I'm gonna try switching. Yep, nope, that's it. So everybody can do it. You don't need anything fancy, and it's worth doing. All right?
Thank you, Dr. Amber Stevens. We appreciate you bringing